Hello, my name is Julie Hebert. I'm with Jim Hall Insurance, and I'm here to go over your Tech Quip group benefits for the year starting April 1st, 2021. This year, we do have quite a few changes, so please listen closely and hopefully you'll learn something you didn't already know about your benefits. And my contact information is included here, as well as the email that you'll receive. There's my phone number and email. Please feel free to give me a call if you have any questions after you listen to the video. So last year, TechQuick moved the medical coverage to All Savers, a division of United Healthcare. In 2021, they're going to continue their coverage with All Savers, but this year we're going to offer up to 3 plans for you to choose from on your medical insurance. And we'll go through each of those in detail because they have pretty big differences. It's important that you understand which one is best for you and your family. The life, voluntary life, disability, dental, and vision will continue to be covered with MetLife. TechQuip will continue to pay 80 to 90% of the employee premiums for the health insurance and 20% for the dependent coverage, which is very generous. So All Savers was a division of United Healthcare. You guys were with them last year. So we're going to continue with plan number 1 is the exact same plan that you've been on before. It's the Choice Plus network. It is the widest network that United Healthcare has, and it's what you're currently covered under. Another option for you next year is going to be an EPO, which is an exclusive provider network. And you'll be using there the Charter Value Network, which is basically the Kelsey-Seybold network. And we'll talk a little bit more in detail about that. This would not be the best plan if you're in Texas. If you're outside of Texas, the coverage is not good there. Then another option for you is plan number 3 is also an EPO, an exclusive provider network using the Choice Network. So when we get into the medical coverage, we'll go a little bit more over each of these 3 choices and the pros and cons and what might be best for you. The dental, there were no changes in the benefits or the cost, neither for the vision. The long-term disability will continue. It's paid for by TechQuip. You receive up to 60% of your salary, up to $6,000 a month in a benefit. Life insurance, TechQuip provides $25,000 of term life insurance with accidental death and dismemberment. If you were to die in an accident, it would be a $50,000 benefit. You also have a voluntary life option that's available to you that we'll go over as well. So the medical insurance, as I said, is through All Savers. So please look here. So plan number 1, this is the same plan that you had in 2020. It's the same PPO network. It's the Choice Plus network, which is United Healthcare's largest network across the United States. It does have the option of in-network and out-of-network benefits. So if you accidentally end up at an out-of-network provider, you will receive some care and some benefit from your insurance. It does work all across the United States. So if you work outside of Texas, this is going to be the best plan for you. We'll go over the specifics of the plan in a moment, but just remember, this is the plan that you had last year, okay? Plan number 2, this is one of the new plans. So this is an exclusive provider network using the Charter Value Network. In Houston, that means that you are going to go to a Kelsey-Seybold clinic, hospital affiliated organization, and doctors affiliated with Kelsey-Seybold. It's a great facility. There's one right there close to where the TechQuip headquarters are. And so if you are in that area and you don't have a strong preference about a doctor, maybe you're willing to go to Kelsey-Seybold, this is a great option for you. It's going to be less expensive and you're going to have lower out-of-pocket cost on this plan. This is not a good plan for you if you work in Louisiana or Oklahoma, because you will not have out-of-network benefits and you will not have any option to go to a Kelsey-Seybold clinic outside of the Houston area. So if you are in this plan, you will go to Kelsey-Seybold for your hospital, for your doctor, for all of your medical needs. And if you go outside of the Charter Value Network, you have no benefit. So it's really important that you understand your benefit and that you understand your network and that you're always trying to stay within that. Plan number 3 is also an exclusive provider network. It's an EPO and it utilizes the United Healthcare Choice Network. So it's the same network that you have on plan number 1. So it's the same doctors, the same hospitals. You have freedom of choice throughout Texas. It's a great plan if all of your doctors are in network. You don't foresee yourself having to go out of network. You could choose this plan if you're going to stay and live and work in Texas, because you would have the ability to go to the Choice Network, which is basically the same as the Choice Plus network. The difference between Choice Plus and Choice is that on Choice Plus, you do have out of network benefits and out of state benefits. So if you live and work in the Houston area or the Dallas, San Antonio, any of the areas within Texas, this network would work well for you. Again, if you're out of state, you really need to stick with plan number one. So here's some side-by-side comparisons on each of the plans. So plan number one, as I mentioned, Choice Plus Network. This is your current plan. Choice two is that Charter Value, which again is the Kelsey-Seybold network. Plan number three is just the Choice Network. So the same network as the Choice Plus without the option of going out of network. So it tells you here if it's a PPO or an EPO. So EPO says out of network, no benefit. PPO says you're going to do better in the network. You're going to get a better payment on your insurance. But if you happen to step outside of the network or you're in an area where you don't have a network provider, we're going to provide you with out of network coverage. So is it accepted outside of Texas? This is very important if you are a worker outside of Texas. Yes on number one and no on two and three. The calendar year deductible per person is the same across all three plans. The co-insurance is 80%. So after you spend the first $3,000 per person, the insurance is going to pay at 80%. You're going to pay at 20% until you reach your maximum out of pocket, which is $7,350 on plan one and $7,900 per person on plan two and three. The primary care physician copays are $30, $25, and $25. Now, plan number two is the only plan that is going to require you to have and designate a primary care physician. They will work as the gatekeeper for your care and refer you to specialists. A specialist visit will cost you $60 or $75 on these two plans. Inpatient care is deductible and 80%. Outpatient care, you reach your deductible, then they're going to pay at 80%. Urgent care on plan one is going to be a $100 copay, and then everything's covered. And then $50 copays on plan two and three. Wellness checkups are covered at 100% on all three plans. We do encourage you to go every year and get an annual physical or well woman visit and make sure that you're taking advantage of your well visit exam coverage. If you have to go to the emergency room, you're going to pay a $300 copay in addition to meeting your deductible and paying 20%. So we encourage you to try to use an urgent care where possible, because you can see they're incentivizing you to go to the urgent care, where they say if you go to the urgent care, you're going to only pay $100 or $50, and then we're going to pay for everything else. Where at the emergency room, they say, well, if you come into the emergency room, you're going to have to pay $300 copay. Then you're also going to have to meet your deductible and co-insurance amounts. Make sure if you're going to have any kind of imaging done that you get prior authorization from the insurance company. Make sure that your doctor's office is working with the carrier to make sure that's covered. The prescription drug plan is the same on all three plans. And there is the cost for employee only and employee and spouse, employee and children, employee and family. So as I mentioned at the beginning, it's very important that you understand the differences between these three plans. You're going to have the biggest choice in plan number one, the widest coverage, in-network and out-of-network coverage. Plan two is going to put you in that Kelsey-Seybold organization, and you will be required to have a primary care physician, as is noted right here on this chart. And they will work as your gatekeeper and refer you throughout the Kelsey-Seybold organization. Plan number three is going to function much like plan number one, as long as you're staying in the network and you're not traveling outside of the state of Texas or living outside the state. If you had an emergency on vacation, you would be covered, but it's not designed for someone that traditionally lives and works outside of Texas on a routine basis. So hopefully that's a little bit of explanation there on the plans, and you can see the cost reflects what options you have available to you. To have the most options available, it's going to cost the most out of each paycheck, versus when you're willing to limit your choices a little bit, makes it a little bit more affordable for you. As I mentioned, an urgent care facility is much more affordable than an emergency room visit. So we encourage you to find an urgent care facility near you, verify that they're in the All Savers network, and use this facility for minor emergencies instead of a hospital emergency room. Now, if you go to an emergency room and it's a true urgent emergency and they admit you to the hospital for what you went in for, say you feel like you're having a heart attack and they admit you for an overnight visit or a surgery or something like that, you will have that emergency room copay waived. What they're trying to do is keep you from going to these facilities that are standalone emergency rooms. So be very wary of those facilities. In the name, if it says emergency room, you will be charged an emergency room cost. If it says urgent care in the name, then you will fall under the urgent care guidelines. There's some information about how to find a provider, and this would be very important if you are any of the plans. It's important to know that you're going to an in-network provider because you're going to receive the best benefit for the lowest cost possible. So there's information on how to go to the My All Savers website, and you select which network you're in and your zip code, and you can find all kinds of provider information. As I mentioned, you do have a $25,000 life insurance policy that's provided by TechQuip. If you were to die in an accident, it becomes a $50,000 policy. There is a reduction for as you get older, your death benefit declines. If you have a change in your family status and you need to change your beneficiaries, please let us know and we can do that for you. Alma and I can take care of that for you. Long-term disability, as I mentioned, if you are out of work for more than 90 days, you can receive long-term disability until you reach Social Security retirement age. And that's 60% of your salary up to $6,000 per month. And again, TechQuip pays for this benefit for you. The dental insurance is provided through MetLife, and that's not changing from what you've had last year. So it is a PPO type plan. You will receive preventative care is covered at 100%, so you can go twice a year and get your teeth cleaned. If you have basic care is covered at 80%, and major care is at 50%. Orthodontia for children is covered at 50%. You do have a $50 deductible once you outside of your regular teeth cleanings, and you have a annual benefit of $1,500. So if you have quite a bit of work that needs to be done, you might work with your dentist and see if you could do some 2021, some in 2022, and try to take advantage of that full $1,500 each year. And you do have a lifetime benefit on orthodontia of $1,500. And the cost is there for your semi-monthly payroll deductions. Again, TechQuip pays 75% of the employee's premium, which is very generous. You also have the option to purchase from $10,000 to $500,000 of life insurance on yourself. You can purchase 50% of whatever you have on yourself for your spouse, and you can also purchase $10,000 per child. So you're eligible for this benefit the first time you're eligible for benefits. And there's a guaranteed issue of $50,000 for the employee and $25,000 for the spouse and $10,000 for the children. If this year you decide, you know what, this whole COVID thing's got me a little nervous and I want to apply for some more coverage, you will have to answer some medical questions with an evidence of insurability form that's embedded in the EASE enrollment system that we'll go over in just a minute. But if you have any questions about that, I'm happy to answer them. You can email or call. But there's some information about the cost, and you can actually look at it live on EASE and select your different amounts, and it'll tell you what your per paycheck amount is. If you do increase your amount this year, you will have to complete that evidence of insurability, and we won't start payroll deducting that until we know you've been approved. So we want to make sure that that's all going to be okay first. So life insurance is again through, vision insurance is through MetLife, and you can go to the eye doctor for $20 and you have a copay of that for your exams and materials. And you can get contacts and lenses or have a $150 allowance. and you can go to the metlife.com, find a vision provider. And again, you're going to do much better if you can go to a MetLife provider and stay in network. If you go in network for the vision provider, so your eye doctor, and then also for getting your glasses and contacts, if you can stay in network, you'll get a much better benefit. The cost is there. So open enrollment is going on right now. It's going to start March 1st. We're going to try to have everyone finished up by March 15th. And if you need to make a change, this is the time when you can add or drop or make any changes for any reason at all. If you have a qualifying event throughout the year, like a marriage, death, divorce, adoption of a child, if your spouse loses coverage, you do have the option within 30 days to let Alma and I know, and we can make a change in your enrollment status. If you have previously declined coverage and you decide to enroll in the dental or vision, you will have a little bit of a late charge for that. And you have to keep the vision coverage for at least 12 months. So Medicare coverage, if you're a new employee, you have 30 days to enroll. There's some information about COBRA if you decide to leave TechQuip, how much it would cost you to continue the insurance. So this year we're going to be doing our enrollment through EASE, and I'm going to just show you a quick demonstration of what that looks like. This is an online enrollment system. You'll receive an email from me at gmail.com. And let's see if I can get this to work. Okay, so this is what it will look like, and this video will actually be embedded in your enrollment screen, so you'll be able to watch that as you open up and get going. So it's going to ask you to go over all your personal information that's already loaded, so you want to check all that, make sure your dependents are included accurately. It's going to ask you if you have Medicare coverage to put some information there. And then it's going to give you the choice. It's going to show you what you're currently enrolled in and what medical plan you currently have, who's covered. And then you have the option of making changes here. So right now it's showing that I am enrolled in the traditional EPO plan. I'm sorry, plan number 3. But if I was in plan number 1, my cost would be $235 per check. And if now I decided I wanted to cover my husband, it would then update my amount here. But then if I say, you know what, I'm not going to cover anybody but myself, I'm just going to waive all these guys, my cost would go down to $54. And this is showing the benefits per paycheck. And as you go along, you see you can choose the different medical plans there, and you can actually look at a little summary and compare the plans. It'll put them side by side, give you some information there, much like what's already in the handout. And you can choose your coverage, and then you just hit continue. And you move along to the dental plan, the vision, long-term disability, and the life insurance. And then once you get to the very end, you're going to make sure that your beneficiaries are up to date. You're going to review your coverage, and you're going to get to look at a summary. Then it's going to ask you to sign the forms and finish. Make sure you go all the way to the end and you get a little congratulations, you've completed. And it will send you an email link to all your documents that are completed. And it will send all that information to Alma and I so that we can process it with the carriers and make sure everything is handled appropriately. But hopefully you'll enjoy the program. It's pretty intuitive, self-explanatory. If you have any problems at all, please give me a call. I'm happy to work with you. If it's just a little bit too daunting for you, call me and we can do it over the telephone. But looking forward to another successful year with you guys. And if we can help you at all, please give us a call. And if you have any questions, thanks so much.